COPD is a condition characterized by lung tissue damage caused predominantly through smoking. Patients can present with cough, shortness of breath on exertion, and episodes of sudden worsening of their condition known as exacerbations, which may require them to be admitted to hospital if they are severe enough. These exacerbations can be quite frightening for the patients and their carers, and patients may need to be admitted to hospital for up to a week.
To meet with us today. The whole point of this piece of research is to talk about your experiences with COPD. So it would be good for us to kind of maybe start at the beginning to tell us when you were first diagnosed with COPD, and can you just describe what happened?
Well, it started at work 1999, just before 1999. I was talking to my supervisor and I was getting, my chest was getting tight and I just couldn't speak.
Yes.
And of course it went on, and coming up to 99 I had to go and see the company doctor, which is in Sloane Square, and he assessed me, but it wasn't processed like that. He told me, I said, no, you're out, you can't work anymore.
COPD discharge care bundle is essentially a checklist which is completed by nurses and doctors during the patient's hospital stay. There are 4 elements to this bundle. First of all smokers are offered smoking cessation advice if appropriate. Patients are given a COPD information booklet prior to discharge. All patients are taught correct use of their inhalers, and finally they are given an outpatient appointment for 4 weeks before they leave hospital. In addition, all patients are rung 3 days after discharge to ensure that their condition is improving. Has the bundle shown any improvement in patient care? This slide shows an audit of 50 patients before the introduction of the bundle as to how well doctors were at asking about smoking cessation, giving COPD information, checking inhaler technique, and arranging an outpatient follow-up. The column on the right shows the figures have significantly improved after introduction of the bundle. This slide shows regional sequin data on COPD readmission rates for West Middlesex Hospital. In 2009-10, the baseline 28-day readmission rate before the introduction of the bundle was 23.6%. After a year of introduction of the bundle, the 28-day readmission rate has reduced to 18.4%, which represents a 26.4% reduction in 28-day readmissions. 82% of patients who replied found the bundle very useful, and in liaison with our patient representative, we have made a COPD website information. So in summary, I hope we've demonstrated that use of the COPD discharge care bundle can improve patient experience, reduce variation in care, and also allow a reduction in readmission rates.